Hi, my name is Gabby. I'm going to be the massage therapy student for today, and today we're going to be doing another palpation video. For this palpation video, I decided to palpate the flexor carpi radialis. Again, let's begin with the benefits. It will help me determine the resting tone of a muscle, and it'll also help me determine if there's any abnormalities in the muscle, such as tone, texture, anything like that. Some of the risks is that if there is pain or discomfort, I can reproduce some pain. I can reproduce those symptoms, and yeah, so I can just kind of aggravate those abnormalities if there is any. So let's begin with introducing the flexor carpi radialis. Again, I have my markers. I'm going to mark it in blue this time because on the opposite arm I did the extensor carpi radialis longus, just to differentiate. So, origin is the common origin for all the flexors. That would be the medial epicondyle. So that would be your landmark there. It's very bony, very prominent, so it's not very hard to find. Mark that in blue. And then the insertion is the base of the second and third metacarpal. So it would be crossing the wrist joint, and then it would be coming to the base. So it'd be coming there to the first, second, and the third. Sorry about that. So again, what are the actions? Radial deviation, and then also flexion of the wrist. And as far as fibers goes, generally horizontally, but again, the muscle does lie a little bit diagonal across the forearm, just because the origin in comparison to the surgeon is a little bit off, but generally horizontal. Okay, so let's begin. Palpating with your thumb or your two fingers. I like to palpate with my two fingers usually because I have more surface area to cover with two. Again, like I said earlier, you can use a weight if you'd want, to activate the muscle. However, like I said earlier, with the flexors, the extensors of the forearm, I think it's more beneficial to use no weight and just use against gravity because it doesn't take a lot of effort to stimulate and feel those muscles. And sometimes I feel like the weight would actually get in the way, especially if somebody does not have the strength to lift the weight or add resistance or something like that. Again, so let's start with the lateral epicondyle. I'm going to periodically contract and relax just so I can feel that muscle pop up into my fingers. So what I'm going to do is I'm going to flex and radially deviate. And then again, if you lose your spot, you can just have them do it a couple times. Kind of find your place again and then cross fiber palpate. No temperature, tenderness, maybe it's about a 1. I don't really have a lot of tenderness in my flexor carpi radialis. Tone is okay, and then tendon texture is also maybe just a little bit ropey, but I wouldn't say it's severe. And then from here, again, meaty portions up here, and then once you go distally or further down, then it gets a little bit more tenderness, so you have to really dig in there. Just kind of go across and have them keep doing it. And you can really feel it here just because the tendon pops up right underneath your hand. And then right to the base, right there. And it's actually kind of easy because I don't know if you can see my hand. You can see 3 tendons pop out. This would be your flexor carpi radialis right here. The center one would be your palmaris longus. And this one here would be your flexor carpi ulnaris. So if you just follow the one closest to the thumb, and while you palpate, you would be generally trailing along the flexor carpi radialis. And that would be the palpation for the flexor carpi radialis muscle. Thank you.